Good morning. It's Tuesday, March the 24th, 2020, and I've got a brief update for you. To the amazing citizens, business owners, employees, churches, schools, civic groups, and nonprofits of Beaufort. Over the last few weeks, we've been preparing for a deadly respiratory pandemic, the coronavirus disease 19, also known as COVID-19. I'm sharing all I can, but the town of Beaufort has been given too little information on the spread within Carteret County. We've not been invited to participate in County Emergency Operations Center, and due to patient confidentiality concerns, we are not told about the location of cases in the county. Each day, this invisible pandemic grows, and we don't know where it is. So we must go and make decisions with limited information and with the knowledge that we will get no second chances. And to be completely transparent, I am not as worried about the 70 to 80% of us who will easily weather this storm. I am worried about our most vulnerable, our senior citizens and those in all age groups with pre-existing conditions. Our hospital has limited capacity, and you've seen there's a lack of medical supplies across the country. Also keep in mind our hospital will still need to deal with regular care such as non-coronavirus emergencies, babies being born. We need to do what we can to make sure our hospital isn't overwhelmed. There is no vaccine, and there is limited testing for COVID-19. We must slow the acceleration of this virus. So we can debate the timing of our increased measures to protect our extraordinary community, but we all recognize there really is no alternative. We know we will end up sheltering in place, and the sooner we do so, the more successful we will be. Yesterday, I amended our town's state of emergency issued on March 17th to limit access points to Beaufort, define essential businesses, limit travel to essential purposes only, and provide enforcement for social distancing. In addition to 6-foot spacing, social distancing best practices also include no play dates for kids, no going to friends' house for dinner, and minimizing trips to essential purposes only. This is not a shelter-in-place order, but there's absolutely no reason to delay incremental increase in response to COVID-19. This is the only way to save lives, and now is the time to start working in that direction. The 5 cases in Carteret County that have been confirmed acquired the virus and have been infected for an undetermined amount of time. There are others, maybe many others, in our county who are infected and will not show symptoms for another week. The first COVID-19 case in North Carolina was identified on March the 3rd, and the virus has rapidly accelerated on an exponential curve since then. The first COVID-19 case in Carteret County was identified on March the 20th. Without taking active measures in Beaufort and Carteret County, we can expect the same rapid acceleration of the virus that we've seen across North Carolina, across the United States, and around the world, to include Italy. Without taking measures, we will doom the most vulnerable. As Dr. Emily Landon, the chief infectious disease epidemiologist at the University of Chicago Medicine, said in a powerful statement to her stressed city, if we do this right, you will ask me after this is over why we took these measures because nothing happened. That's right. We measure our success because we want nothing to happen. Our primary goal, nothing happens to your family. We have geography that will allow us to isolate major portions of our community. With this amended declaration, we will close the far eastern portion of Live Oak Street and the Turner Street Bridge, and this means the only access in and out of town will be through Highway 101. With this amended declaration, we do not intend on stopping traffic along this access point, but we may do so in the future. We will get through this together. It is your turn to do your part. We will take these steps incrementally, but again, I fully expect to get to a full shelter in place in the not too distant future. I hope the county will consider similar measures for all of Eastern Carteret County because we are all inextricably linked. We are friends, family, classmates, and co-workers, and we depend upon each other. I would hope that when the appropriate time comes, the county will limit access to the Graydon Paul High-Rise Bridge and the Core Creek Bridge so we can isolate Eastern Carteret County to residents, essential employees, and supplies so we can protect against the virus. Noted public health microbiologist at the UNC Chapel Hill Institute of Marine Sciences, Dr. Rachel Noble, has recently stated, and I fully agree, our our county is currently in crisis. It may not feel like it yet, but I assure you that we are. Today is when we must be different from the masses. Today is when we need to look after each other. Today is the time to act. Thank you, Beaufort.